Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to my YouTube channel Science for Everyone. Today I will discuss about the questions mostly asked by the public related to HIV. Okay, this video is basically for public awareness. So watch this video till end, and this video consists of different questions that are asked by the public about HIV, about the transmission of HIV, that how it is transmitted, and different other questions you will came to know. Here, mostly the question is also includes an adult questions. Okay, so if you are sitting with your kids, so don't watch this video. Okay, use headphones to watch this video because it mostly the questions are related to adults. So keep this thing in mind. So let's start with the video, that what type of questions are asked by the public, and also share this video very much because HIV is in simple words, in a funny way, it is exploring day by day. Okay, and its infectious rate is increasing day by day. So share this video with your fellows, with your colleagues, with your different family members, adult family members. So they came to, so by watching it they will came to know that how to protect themselves from HIV, and also how HIV is transmitted from person to person, and other different basic questions that are asked that are related to HIV. So let's start with the video. I have found a very reliable and very authentic article that consists of many questions. Okay, so I will explain each and every question in detail. So watch this video till end. Okay, so let's start with the questions. Sorry, wait a minute. Okay, let's start with the questions. Okay, wait, I want to zoom it. Okay, so the first this is an informative that HIV can only be passed on from a person to another via the following bodily fluids. जो हमारे साथ HIV है, it can pass from person to person with the blood. Okay, our blood, an HIV infected person consists of high load of HIV, and it is present in its blood. Okay, so the best transmission source is the blood. Okay, if a person is having HIV and his blood come in contact with a person, with a normal person, okay, with the blood of a normal person, so definitely he will get the HIV infection. Okay, semen, including just leave this bracket, just concentrate on the semen. So a man semen also contain HIV virus, and he can infect his fellow. Okay, vaginal fluid. Okay, that the woman that the fluid of the vagina also contains the HIV, and anal mucus. Okay, it also contains the HIV, and the most important is the breast milk of a pregnant of a newborn जो mother होती है, ठीक है. So its breast milk also contain high amount of HIV. Okay, and so this was about that the different parts of the body and different fluids of the body that contain HIV in a high amount. Okay, and I want to tell you that okay, I will proceed in the questions you will then come to know. Okay, HIV infection occurs when infected bodily fluids get into your bloodstream in these ways. What are the ways? Unprotected sex, okay, including sex toys, okay, when there is a HIV on the sex toy, then a person is using it. Okay, so then he can get it. And from mother to child during pregnancy, childbirth, or breastfeeding. First of all, if a woman is pregnant, so she can pass the HIV through her placenta, and it can get access to her baby. Okay, that is present in the uterus, so it can cross the placenta and enters the baby. Okay, childbirth. During the childbirth, it can also the child can also get the HIV, because there is different bleeding, and the mother blood contain high amount of HIV, and it can come in contact with the mm, her baby. Okay, with the help of the umbilical cord, or with the different type of, you know it well. Okay, and also the breastfeeding. Okay, when an HIV infected woman should never give her milk to her baby. Okay, because the breast milk contain high amount of HIV. Okay, injecting drugs with a needle that has infected blood in it, and it is very common. Okay, nowadays, the basic most of the HIV is transmitted because of this step. Okay, this point. And the fourth one is an infected blood donations or organ transplant. For example, we all know that an HIV person have when a person is infected with HIV, so his blood contain high amount of HIV, and when it is that blood is transfused, that blood is donated into another person, so he can get the infection. Okay, organ transplant. If a person, an HIV infected person, donate his organs, okay, so the other person will get the HIV. Okay, because its organ contains blood in it, so and that blood consists of high amount of HIV, so it's common. Okay, now you can't get HIV from, okay, the first one is kissing, and hugging, sharing food, insect bites, toilet seats, bathing, sneezing, and cough and sweat. Okay, I want to tell you guys that an HIV virus is too much weak when it is out of the human's body. Okay, so it cannot withstand the environment of the saliva. Okay, because our saliva is slightly basic, so it cannot withstand that environment, and it is destroyed. So a person that is infected with HIV usually contain a very less amount of HIV virus in his or her saliva. Secondly, I want to tell you that there is a threshold for everything. Okay, for example, thousand a population of 1,000 HIV can cause an HIV infection. Okay, and when if the number of that HIV is reduced, so it cannot uh, cause the disease, because there is a always a threshold for anything. So our saliva, or sorry, the saliva of an infected person contains the HIV, but it is in very much less amount. And just because of that less amount, if a person engulf it, so could not get the disease, because it does not reach the threshold. Okay, so that's why hugging. Okay, so I know I told you that it can only be a person that hugs an HIV infected person could not get the disease. Okay, sharing foods or insect bites. So insects can also not carry HIV. It cannot be as a vector. Toilet seat, for example, there is HIV on a toilet seat, so it could not be a person could not get it, because I have told you again and again, this virus is too much weak when it is outside of the body, so it is directly killed by the environment. Okay, the air, the sunlight, and the environmental conditions. Okay, bathing. Bathing is that HIV cannot survive in water. It is directly killed inside the water. So if a person is HIV infected and he baths, normally people that they bath together, so it could not they could not cross the HIV could not be transmitted to across them. Sneezing and coughing. So a person that is infected with HIV could not transmit the HIV through sneeze and cough, because I told you that there is very much low load of HIV in the saliva. So that's why. Sweat, we all know that sweat is slightly acidic. So an HIV can never be alive in the sweat, okay? Or if it is alive, so the population density is too much less, okay? So it could not reach the threshold frequency, okay? So these were the you can't get HIV from. Hope you have understand it. Now here are the different question. Someone who has a undetectable viral load. So if a person has undetectable viral load, so he could not transmit it because he is not having that much viral load that could transmit to the other person, and he or she could get the disease because he is not having sufficient amount of HIV in his body, okay? So he could not get transmitted. Someone who doesn't have HIV, so he could not. It is a very simple question. Touching someone who has HIV. So HIV can only be transmitted through specific bodily fluid. So you can't get HIV from touching someone, hugging them, or shaking their hands. I have told you, okay. Kissing, you cannot get it from kissing. Sweat, tears, urine, or feces, or someone who has HIV. So HIV cannot transmit because if we look to the sweat, the tears, the urine, the feces, the environment is very drastic for that HIV. And HIV is a very much weak virus when it is outside of the body. And it is an adult question that mutual masturbation, so that fingering and hand jobs can't give you HIV. However, if you use sex toys, make sure that you use a new condom on them when switching between partners, okay? Used condoms, if condom is used, okay, so HIV in semen can only survive for a very short amount of time. So when it is switched to a person, so there is an ample time that HIV is killed, okay, because of the environmental condition in the air, okay. Okay, air. HIV can't survive in air, I have told you. Cough, sneeze, or spit, there is only a trace of HIV in these bodily fluids, so they can't transmit HIV. Food, drink, and cooking utensil. HIV can't be passed on through sharing food, drinks, or cooking utensil, even if the person preparing your food is living with HIV. Toilet seats, again it come. Water, HIV can't survive in water, so that's the main reason. Insects, it cannot be passed from the insects or animals. New or sterilized needle, if we use sterilized and new needles, so it is very better for us. Musical instruments, HIV can't survive on musical instruments. And tattoos and piercing, there is only a risk if the needle used by the professional has been used in the body of someone living with HIV and not sterilized, okay. It is just like the blades and the different equipments that is used in the surgery. Then and if there is a HIV blood over it, and if it can come in contact with your blood, so you will get the HIV. You can't prevent or cure HIV by, if you have sex with a person that is infected with HIV, and when you came to know and you have done the sex, and if you start washing that area or start bathing, but once it get inside your body, then you have get it. Okay, that pulling okay, sorry, I'll discuss it in the here. Can you get HIV through oral sex? So the risk of HIV from oral sex is very small unless you or your partner have large open sores on the genital area or bleeding gum sores in your mouth. Okay, so if a person is HIV infected and he or she have sores on his body and the blood is coming out of it in a very less amount, but there is blood, and if it come in contact with you, so you can get it. Okay, can you prevent HIV with herbal medicines? So I want to tell you guys that there is no such cure with the help of herbal medicines. So no, some people choose to take alternative form of medicine such as herbal medicine as a natural way of treating HIV. However, herbal remedies do not work. The best is that you should take antiretroviral treatment. And I have discussed the mechanism of the medications that is used in the HIV infection in, I think, in the previous video in the medication part. Okay, so you watch that video, that how antiretroviral treatment is conducted and how these medicines perform its function in the body. Okay, if I get infected fluid from an HIV positive person into my body, will I definitely get HIV? So it is the case is that if her or he or she blood contains the a high amount of viral load in its body fluid, so then you can get it. Okay, you just read the text. Okay, isn't it HIV only a risk for certain groups of people? Like most illness, HIV doesn't discriminate between types of people, and the infection can be passed on to anyone via one of the ways mentioned above. So some people are more vulnerable to HIV infection if they engage regularly in certain activities. Okay. For example, there are two persons, and one is involved in very unhealthy activities. So he is the most vulnerable person to get HIV, and the other, if he is leading a healthy life, so then he could not get the HIV. I am HIV positive, so is my partner. For example, there are two people, a husband and wife, and they are both HIV infected. So we don't have to worry about HIV. For example, there are two-person, male and female, yeah, husband and wife, and both are HIV infected. Okay, so their question is that, so we don't have to worry about HIV. So the easy answer is that there is a chance that the husband contains different species of HIV and the female contains different species of HIV, because I have told you that HIV is continuously changing its antigenic properties. Okay, so if those two contains different species of HIV, so then these species will get access to each and every husband and wife. The husband species will enter his wife, and the wife species will enter the husband body. So just because of different species and uh, here the text is that if you get infected with two or more strands of HIV, it can cause problem for your treatment. Okay, if you are treated with if you diagnosed and if you are infected and you are diagnosed with HIV, so then your strain will be examined, that which type of strain you have, and according to that strain you will get the medication. And if you get another strand, so then if one strand is suppressed, so the other strand will continuously replicate. Okay, so then it will be a problem for it. Okay, it's easy to tell the symptoms of HIV. Okay, so if a person is immunocompromised, so he will have different symptoms. If a person is strong in immune, so his immunity is strong, so he will have different symptoms, or he or she will have no symptoms. Okay, so it's not easy to tell the symptoms of HIV. So these were all the questions that was asked by the public. and hope you understand this well, that mm, how HIV is transmitted, and what are the questions that are asked by the public. So I think you get your answers, and stay safe, because this virus is very, very alarming. This was my last video over HIV. If you want to get educated related to HIV, that what is HIV, what really HIV is, so start from the video number 1, and and watch this series till last. Okay, so then it will be very much clear to you that what really HIV is. Okay, so thank you very much for your concentration. If you have any further question, you can ask me in the comment box. Share this video very much, because it is a public awareness. Most of the people are not aware from this disease. Okay, and they are not using the precautions. Okay, and they are mostly involved in unprotected sex and unprotected activities. So that's why just share this video very much, so that people are acknowledged. My channel is Science for Everyone. I deliver lectures in a simple way, so that it should be understood by each and every person if he or she have a little education. Okay, so thank you very much. Stay safe and stay blessed.